Sorry about that. Hi, everyone. My name is Daniela Rojas, and it's such an honor to be here today with all of you in this Blue Circle Talk about why diabetes education matters. Today, we're going to have a wonderful talk, an interactive session alongside some wonderful panelists, which I'll be delighted to introduce in a moment. But before we start, I wanted to make sure to let everyone know that this panel today is interactive, and we're very excited to hear about all of your opinions and all of your questions regarding diabetes education. So please make sure to take into account that we have two chat boxes today, the regular chat one, and we also have a question and answer or Q&A one. So please make sure to use that one to make all your questions, and I will be more than happy to do them and address them to our panel today. Some important first things is, well, I'm going to introduce myself now. My name is Daniela Rojas. I am a person who has lived with type 1 diabetes for 31 years now. I am a very happy member of the IDF Blue Circle Voices. I am also a psychologist and a certified diabetes educator, as well as diabetes advocate from Costa Rica. And I work really hard for the Latin American community. And I am delighted, as I said before, to be here with you all. And I'm just so happy to see that we're having people joining from all around the world. And as mentioned before, we're very excited to share this space with you and to actually learn and share from you. So please do not hesitate to leave your comments and questions throughout the entire session, and we will make sure to address them to our panelists. So before we start, we do have some little things that I want to make sure you all know is that this webinar will be recorded. You can activate your Zoom-generated subtitles. That is very important. If you might need them, please just make sure you do that. And please be aware that they might not be 100% accurate, but they might help you to better understand in case you need this. The recordings and the feedback will be sent to the people that are registered in a few days. And people who attend at least 80% will receive an attendance certificate by February 12th. So once again, something very important. I know sometimes we're just so excited, but make sure to use your Q&A chats to make the questions to our panelists, and continue to use our chat box to say comments and to say hello to everyone who's around here. So it's just wonderful to be here, and let's get started. So today, as mentioned, we have a wonderful panel with us this morning, well, or evening or night, wherever you're joining from. And it's a pleasure for me today to present Frances Georgel. She's an IDF Circle Voice member, and she is a project manager. She's project manager from the SNCB from Belgium. We also have the honor to have Heather Koga. She's also a member of the IDF Blue Circle Voices, and she's joining from Zimbabwe. And we also have Manuel Jaime Elias de Mexico, and he is part of the IDF Young Leaders in Diabetes and is an advocate in the Mexican Diabetes Federation. It's just wonderful to have them all here. And as mentioned, we're going to have a very interesting interactive panel with the three of them when we will be sharing about the value and the importance of diabetes education for each one of them. And we hope to learn about this subject about you as well. Hi, everyone. Good to see you again.
Hello.
Hi, Daniela.
Hello. Wonderful to be here with you. Hello, Heather. There you are.
Hello.
Wonderful.
How are you?
So as mentioned today, we are celebrating the International Education Day. And of course, as people living with diabetes, as people working with communities that live and work with diabetes, it's just a great panel to talk about this. How does diabetes education impact our lives? And it is important because as I think we can all agree that diabetes education has a tremendous impact in quality of life, not only for those of us living with diabetes, but also all those around us, including our community. And it is important for us that all of those working and caregiving and loving and sharing and living with this condition have access to education. And today is really wonderful to be able to share with you three. We're going to have some questions, but please make sure to know that we can all share and pitch in. And we will be having questions from our panel, and I will make sure to send them to you as soon as they come in. 1 second, because right now I'm opening my question, and here we are. So this morning we're going to start with you, Heather. So we're going to start with you and your questions. And the first question we have is, why is diabetes education so important in your community and country?
Thank you very much. I would say diabetes education is very crucial, not only for people with diabetes, but also for their caregivers, also for healthcare practitioners, and the public in general. And this is in the context of my country as well as everywhere else. It's crucial for people with diabetes and the rest of the stakeholders to be able to be aware of the nature of the condition, the treatment options available, the risk factors, the complications. And it's very important that people receive education because of the several benefits, like promoting early diagnosis, preventing or delaying the onset of the condition. And this is particularly true for type 2 diabetes. And we have times when education is really crucial, not to say that at other times it's not important, but there are crucial times like a diagnosis. When you are being diagnosed, it's very important that you get to receive some kind of education and training on where to start from with your diabetes management. And there are also times when a person is not meeting their treatment goals or targets. It's also important at that time to be able to have refresher training and refresher courses to be able to get back to good management. When you are having complications, this is also a very crucial time for education to be given. And then there are certain times in life, maybe when you're experiencing some transitions. It could be care transitions or general life transitions. You also need to be refreshed and to be educated. So besides people with diabetes, we have people with, we have stakeholders like maybe health practitioners, we have their caregivers. And maybe at this point, I also want to mention, just in brief, that in Zimbabwe, we have a lot of efforts at diabetes education. And we have several institutions, several establishments, groups, big and small, that are really delivering and making an effort to educate people on diabetes. And without diabetes education, we will perpetuate ignorance on the condition. And this will lead to the poor management of the condition. This will also lead to a lot of misinformation going around about the condition, which promotes stigma and discrimination, things like myths going around which are not true about the condition. And I would also want to mention that diabetes education should be continuous throughout your journey with diabetes. It's not only important at diagnosis or at any of the other times that I mentioned, but you should continuously be receiving education because of the new knowledge that is always coming up and because of the new technologies and everything that is coming up.
Heather, thank you so much for that answer. I could not agree more. And I believe you just make some crucial remarks in the value of early diagnosis. it's 2024 and worldwide we're still dealing with late diagnosis and putting health peoples at risk. So thank you for bringing that up, as much as also I saw a lot of comments in the chat about what you mentioned in regards to stigma and bias. And that is something that is also so true about the value of diabetes education, not only within ourselves as people living with diabetes or loved ones or caregivers, but also to prevent us from stigma outside of our own community. So thank you very much for that wonderful response. And thank you for everyone commenting on that chat and for your input. So this next question goes to Manuel. Manuel, hola, ¿cómo estás? It's also wonderful to see that we have a lot of people from Latin America in our chat. I just saw someone joining from Uruguay, so it's just wonderful to see you and have you here. Manuel, we have this question for you. What do you think is the biggest obstacle to diabetes education in your country?
Okay, thank you, Dani. Hola, Dani. Hola, toda la banda LATAM. Thank you to be here. Okay, what do I think is the biggest obstacle to diabetes education in my country? Well, I am from Mexico. I live in Mexico City. And I think the biggest obstacle to diabetes education in Mexico is the lack of access to quality education. Like, Mexico is a really great country, but it is a country with great social and economics inequality. And well, it is not easy for everyone to support their families, and also with the low wages and difficulties to afford some supplies or even get the right education in diabetes. I think according to the Mexican Diabetes Federation, only like 10 to 20% of people living with diabetes in Mexico receive the adequate diabetes education. So, well, I think the main factors are like the inadequate training of the healthcare professionals, and also the lack of resources and some cultural barriers that we have in our country. For example, in Mexico, I think we do not have like the necessary and right training to these healthcare professionals. And for example, in rural areas, the healthcare access is very limited. So we don't have like the right information for all the people living with diabetes all across my country. Also, with the lack of resources, I think that diabetes programs here in Mexico are often underfunded. So, well, we have a really big lack of resources to these kind of programs. And also the cultural barriers, like in Mexico, we have like this stigma of what living with diabetes truly means. So I think that also is a factor that makes the diabetes education more difficult to Mexican people.
Thank you so much, Manu. That's sadly really the reality of a lot of countries in our region, and thank you for advocating towards that. Often people think that even people in various countries around the world, some of them do have access, but some of them don't. They don't even, like you mentioned, don't even have access to treatment, let alone education. And it's as a mental health care professional, it's also really tough to, even when you have your treatment, not having proper education and how that impacts your healthcare and your health as a whole. So thank you for sharing that. Does anyone else in our panel want to share about this? Because we all do face different obstacles worldwide. Does anyone, would Heather or Francoise, would want to join, or should we continue to our next question?
Yes, just a brief comment, just to agree with the sentiments about access to diabetes education. As I mentioned, in Zimbabwe, we have a lot of efforts on the ground, but the reality of the situation is that access is very limited. We have most of the big associations and establishment in the major cities. So there are some remote areas that are really hard to reach. And in those areas, access to education is very limited. And those areas are also a bit far from the major hospitals, where we also have better access to diabetes education. So at the end of the day, we are saying only a very limited number of people are accessing this education, and there's need for efforts to reach other places, especially the remote rural places.
Thank you for that, Heather. That is of so much value as well. Often there are so many communities outside in rural areas that lack the opportunity to be educated. And something that I would think it's also important to add on that is very common, at least in our region, is the fact that often parents of kids living with diabetes are not the ones caring for the kid. A lot of the times are the grandparents or other peoples in their family that are often not educated at all, which make it very complicated, and it's a massive obstacle that sometimes only the people allowed within hospital care, which are often the parents, are not the ones caring for the child when we're talking about peds, and often even partners are not allowed into hospital, and it makes it difficult for them to also have access to education, and that's something that we should definitely work on to hopefully make it better. So moving on, we go with you, Francoise, and I am really excited about this question as well. And I wanted to ask you, what is the hardest challenge you would say you face every day, being the caretaker of your son? Now that we're talking about caregivers and caretakers, besides sleepless nights that we all do know and can relate this, and I would really want to hear about your experience in motherhood in this area.
First of all, thank you for inviting me, because I think it's really important to share, and I would like to make a link with what was said just before by Heather, which is especially for kids who have diabetes type 1, it's very difficult to spread the specificities, the knowledge about the specificities of this condition, because the older people who take care of my child, for example, at school, they know a lot about diabetes type 2, but not about diabetes type 1. So especially about nutrition, they can say maybe, oh, why are you eating that? That is not something a diabetic person should eat. And actually, the difference in nutrition pattern is so big that we as parents had to go back to school and try to educate kindly the teachers to the fact that my child, for example, can have cheese at 10 in the morning instead of having a cookie. Which is something, for example, the mother of the secretary at school who has diabetes type 2 cannot do at 10 in the morning. So I think it's very complex to deal with diabetes type 1 and type 2. So we cannot blame our entourage not to be aware of all those details. But even in Belgium, even in Brussels, I see this lack of knowledge. Knowledge is not widespread as it should, because, for example, we have a nurse, even 2 nurses in the school where my son is educated. But we had to ask our hospital to go to school and give trainings to the teachers, because even them could not really handle the complex life of dealing with diabetes, nutrition and sports and feelings, and it's really a complex matrix. And I think it's very important to start somewhere educating people around, because then the questions arise, and then that's when we've been asked as parents to go and answer the questions of the friends of the class friends of my son. And so we had questions like, why can he have candies whenever he wants to have candies? So we had to say, no, it's just because he's low. Or why can he go out of the classroom and have a drink whenever he wants? And we had to explain what was behind the whenever he wants. And then kids, surprisingly enough, understood very quickly our graphs about sugar levels. And now they're all cooperating with my son and sometimes asking him, oh, I see on your graph that you're going a bit low. Can't you stop your pump now because we're going to go for the sports class afterwards? So they take it as a collaboration game. Yeah.
That is wonderful. And thank you for bringing that up, because I believe that, and I would want to hear if you agree, that education actually really helps with just taking away stigma and also guilt around living or being a parent of people with of persons with living with diabetes, in the sense that now you're saying that education actually makes your son's friends be a part of his team instead of being the one left out. And I just think that's wonderful, because in my case, it's the other way around. I am the one living with diabetes, and my daughter, she's 5, and we have to explain everything to her. And the same thing, she's like, Mommy, your arrow is going low. Do you need to stop? And she just will see at the pump. But then also, once we had this child come to our house, and she was asking what was wrong with me. She was like, what's wrong with your mom? Why does she have all that stuff? And my daughter says, there's nothing wrong with her. She just lives with diabetes. And you can see what's going on when you look at her pump. And I thought, she was like 3 at the time. And I was like, oh, well, that's good. So yeah, diabetes education can really also be people feel safer around a condition that's often so, like you have, both you and Heather had talked before, it's so difficult for some people to understand, no matter its type. It's usually so hardly and difficultly stigmatized around every place in the world. And just being able to talk about it, to explain it, actually allows you not to be the odd one out, but actually allow you to be surrounded by a team. So thank you for sharing that. It's just so valuable to be able to have people outside the diabetes community to learn and be a part of it, instead of just feeling like the odd ones out. So Heather, we have a question that we might be able to collaborate on, and this would be, what is it that you feel is missing from the training that is currently available for type 2 diabetes? And I think that is a very good question, because type 2 diabetes is so important, and we really need to talk about it as well. So as a professional, what do you think would be the things that are missing in regards to type 2 diabetes education?
I would say since type 2 diabetes is preventable, to say in quotes, and it is also, it can also be delayed. So probably the reason why we are having so many cases of type 2 diabetes is that we are lacking education for people who are at risk, and people who don't have it at the moment but are at risk. So if we were to enhance our efforts so that many people who are at risk are able to access this education, we'll probably be able to cut down on the number of new cases.
Thank you. I also believe that when it comes to type 2 diabetes, it's really important to also talk about also early diagnosis. What we mentioned in regards to type 1, it's also very important to be able to do that. And very much so, we do know through research that people with type 2 diabetes have a tremendous burden in regards to what is stigma and discrimination. And one of the big things should be also being able to really strengthen the education around what truly type 2 diabetes is, so that people outside, and when they outside their household, outside their hospital settings, get a chance to have people educated and be understanding, even supportive of what truly type 2 diabetes is, so that this can prevent being also having stigma in the same way that should be for any other condition. So I agree that it's often very overlooked, and it's often only what people think. And I think maybe, I don't know, Manuel, if you would want to join this in this conversation, but at least in Costa Rica, we see that there's a lot of also misbeliefs, you know, about type 2 diabetes. And if you do this or do that, a magical solution will come along your way. If you
Cinnamon.
so do that. And it's so important to be able to have professional education. And like in the previous question was said, continuous, accurate. And at least in the Latin region, we do have a lot of that situations going on. And I believe Mexico has that as well. So if you want to maybe join on that, Manuel, that'd be great to hear from you.
Yeah, sure, Danny. I don't know if this is like a Latin American thing only, but yes, there are a lot of misbeliefs about living with diabetes, like type 1 or even type 2. Like people in Mexico doesn't even know that diabetes, the type 1 diabetes exists, you know? So it's always like type 2. Sometimes when I talk about my life with diabetes, it's like, oh, Manuel, but you are so young. What is type 1 diabetes? Like some comments like that. But well, I also like to think that from this perspective of diabetes education, sometimes I would like to think most times people doesn't really know this basic information about diabetes, you know? So we should be empathetic and patient and have like this attitude to explain all these basic things because maybe they don't really know, they don't want us to feel bad or ashamed about our condition, you know? So yeah, there are a lot of misbeliefs, but I think an important part of the advocacy in diabetes education is to have this availability to explain all these basic things to everyone that asks us about our condition or about type 1 or type 2 diabetes, you know? So yeah, the misbelief exists, but we can make something about that.
Thank you. And Francois, going back to you as a parent, how do you think you manage to lead your professional life, as well as making time to be there for your son? And has your career changed at all since he was diagnosed, would you say? Has it been a challenge in any way personally?
Well, education helped me a lot, indeed, actually. That's what allowed me to go back working because at the beginning, my son started school only some hours a day, so I could not work. And then I needed to do a lot of reassurance with the teachers about him being able to do sport like the other ones without being too low every time. And now, 8 years down the road, everybody knows about his condition in school, and I can go back to work full time. The learning curve was steep, actually. So every time he changed teachers, we need to go back and explain details and maybe give a tablet and show the graphs and teach them that it's better to react before that he's too low, stopping the pump, or giving a bolus when we see that he's going high. And so this continuous process of educating the teachers and all the people around taking care of him helped me be able to recover a normal professional life.
Thank you.
Yeah.
No, go ahead. No, go ahead, please. Go ahead.
I just wanted to say something about diabetes type 2 also. Here in Belgium, we have this opportunity to ask the Social Security for a refund when we subscribe to a gym. I think that with our way of eating worldwide with hyper transformed foods, it would be nice to work for some kind of lobbying for the governments to help us all subscribe to a gym, because whether we are we have a diabetes type 1 or 2, or we are just people working on a chair the whole day, I think for our health, being able to do some kind of sport, be it yoga or running or whatever, is something that can only benefit our health. And I think it's also very important to delay the onset of type 2 diabetes.
Thank you so much. Thank you so much for that.
Thank you,
And
Daniela.
I also wanted to add that as a mom myself, it was also difficult because becoming a mom, I think you can relate and maybe resonate with this. It's you think you know, but you have no idea is the thing. You know, you prepare yourself, but then when you're caring for someone, it demands of you so much love for it starts and so much time. And one of the big things was also understanding that I was not going to be able to be on top of my diabetes care as much as I used to. And it really made me just want to rethink. And I just really love that question for you, because just knowing that also caregivers and parents, I don't know how many parents or caregivers are here, but I do know there are a lot of people living with diabetes, and often we forget of how much of an effort and sacrifice parents do to be able to return to their lives after their child has been diagnosed. And it's difficult because, as you say, it's not like you just start, you learn, and then you let go. But as you mentioned, every time it changes, you have to go back. So I think that is very valuable and maybe often not set on point as much as it should when it comes to actual diabetes education. How to also care for the parent who has to restart all over through these transitions and to reshape their lives around it, and rethink of their jobs and of their time and even their nights, right? So thank you for sharing that, because on the other end, it's also that way. You know, it's just knowing, okay, I'm not going to be able to be checking my blood sugar all the time, and now I might be off a little, and it's about the baby all the time, but it's often maybe not looked when it's on your side as a parent. So thank you for sharing that. It is very demanding, and it requires a lot of work and also a lot of strength to go back and do everything. So thank you for sharing that. Manuel, back to you. How would you say diabetes education could be more inclusive?
Okay, I like this one. I believe that everything should be inclusive, like always. Like all information should be accessible to everyone without exceptions. Like a basic principle of equity and justice, of access to education and also to supplies. And well, I think with three, I have always believed with three main like topics we can make diabetes education more inclusive, at least in Mexico. Like develop a competent education with these cultural issues. For example, there are over 60 indigenous communities in Mexico. They represent like, I don't know, like the 5% of the country's population. It's an important amount of people. And we should develop our diabetes education to materials that they are translated to their different languages and to the different languages spoken in your country, in this case in Mexico, and also incorporate all these cultural and traditional things and beliefs about health and food to this education that we are developing. Also, I think that if we use diverse examples of what diabetes education should be to all these groups and minorities, it will be better to make diabetes education more inclusive. Also, the access to this information for people with disabilities, like in Mexico, we do not have like that kind of information about diabetes for, I don't know, blind people, talking about Braille, and also to people who are deaf or hard of hearing. We do not have that kind of information. So it is not like full inclusive, you know? Like people living with diabetes, we exist, you know? We exist, we are part of the world, but also people living with other disabilities or other conditions, and they can't live with diabetes too, you know. And I think that most of times we do not think about these things. And yeah, diabetes education is not that inclusive always. Also, there are other issues that we should address as we develop a more inclusive diabetes education. Like we should recognize that people with diabetes face different challenges. based on socioeconomic status, race, ethnicity, and some other factors that determine the challenges living their own life and also living their life with diabetes. So I don't know, we should offer diabetes programs to low-income communities, and this information and this education should be inclusive so they could understand the basic principles of diabetes education. So they can make the right decisions at the right place on very difficult scenarios.
Thank you, Manuel. And adding on to that, I cannot help myself to say that also mental health conditions should also be added on to that. People living with diabetes are prone to having mental health and often not looked at or even are included in diabetes education. And I'm here to remind us all how important it is to also advocate not only for our physical health, but also for our mental health, and to be able to normalize the fact that it is okay to ask for psychological companionship in psychiatry if it's needed and when it's needed, and that it should not be stigmatized, because within themselves, mental health has stigma by its own, but joined to something like diabetes or others, it's often very left out, and it shouldn't be. And I have Francois' hand up. Please do share. Come ahead.
I'm sorry, but I think it's really important. I wanted to thank Manuel for saying what he said about inclusion. Here in Belgium, we can say that we're lucky, but we experienced something firsthand with my son. He wanted to go to the Scouts. And so we talked to the Scouts and they said, okay, we are fine with diabetes type 1, no problem. He can come with us. And so he was there the whole year. And at the end of the year, they needed to do a camp. And for the camp, we went at the meeting. At the last minute, they told us that he could not stay there during the night because even if he was on a pump, it was difficult to take care for him and all those kind of things. So in the end, I had my son really sad because he was preparing a whole year for that camp. And the only solution was that I could propose was to go and camp next to them with all the other kids to take care of him, which actually was refused by the organizers because otherwise, I mean, I was the only mother and all the other kids would have wanted the mother. So what is very frustrating is that in some countries, we say that we are inclusive, that we understand that even if you have a condition, you can live the same life as everybody else. But it is still not true. And that is where education is crucial, I think, because when people do not know something, they just fear it.
Thank you for that so much.
Yeah,
thank you for that.
Yeah,
And to
yeah,
resonate. I'm sorry.
as a kid living with type 1 diabetes too, it feels horrible to be to be stigmatized for who you are, you know. It sucks. I'm sorry for that. But well, also the empowerment and of people living with diabetes is a really good way to make diabetes education more inclusive. Like our testimonies are like this weapon we have to prove that you can live with diabetes and you can have a fulfilling life also.
Thank you both for that. And I couldn't agree more. And I think that something that's brilliant is that, like you said, Francois, you're from Belgium, and that you said it might be a very different reality from what Heather, Manuel, or myself have been open to, but this still does happen, which let us know that stigma and discrimination and lack of education happens worldwide. And that is why actually advocating and raising voices and looking to educate people within the community, but outside the community, can make a tremendous difference for the diabetes community worldwide. So Heather, there's one for you. How do we make diabetes education for people who do not have enough resources? What would you say could be an option with realities that might be not much resources? What would you take on that?
Yeah, that's a difficult one, because for us to be able to take the education to the people, that will also involve the use of resources. But I think there are several ways in which diabetes education can be given to people. Okay, I am an advocate, and I can give an example of a recent intervention that I did. In one of the WhatsApp groups that I administer, people had so many questions about diet, and they, they end up giving each other advice. And some of the advice is not really sound. You can actually tell that, no, this is not really sound advice. So what I did was to approach a dietitian. The first one that I approached could not give me the service, but then she referred me to someone else who was willing to give that kind of service pro bono. So what I did was ask the people to write down questions, everything that they wanted to know about diet. Some of the questions were quite general, but some were really specific. And then I compiled those questions and then I gave them to the dietitian, who then responded to the questions individually. And I was able to take that back to the people. So as much as they did not receive that individualized attention, at least they were able to get something. So that is one way in which we can try to reach out to people. Then obviously we can reach out to people maybe through going there, maybe with some IEC material, information and education material. We can make use of the internet. We can make use of social media to deliver education to the people. Sometimes it's also difficult because some of the people do not have access to social media. But those are some of the ways in which we can try to reach people, especially in those areas where they cannot have direct access to diabetes education, and they do not have the resources to be able to access the kind of education that they want. So it's difficult, but it's possible. Yeah.
Thank you. Thank you so much. And thank you for all the work that you've done, because the realities, like we've been saying, are different worldwide, but diabetes education and access to treatment and care should not be a privilege. It should be a normalized situation for all of us. So thank you for all your work and for everything that you're doing to provide that. So now I think this is a great question for all of us, and I will start with you, Francois, because I think that often we focus, like we were mentioning, on you as the mother of the child living with diabetes, but there are other family members surrounding us, and often that also has to do with our diabetes life. So how would you say family members, this includes parents, partners, siblings, support diabetes education? How would you say that? And Manuel and Heather, please feel free to think about that one as well.
Actually, I was the one who stopped my career to take care of my son, and I was sleeping 4 hours a night, and I was reading whatever I could read about diabetes when he was diagnosed. And so I was the one passing on the knowledge around. So I ended up somehow being the specialist, and I realized that I was not very tolerant because I knew everything about it. And when my ex-husband came giving a Twix or a Raider, I don't know how it's called now, a Mars, to my son who was low, and I was screaming, that's not what he needs. And he was like, so he's going to have something that he also likes. And I needed to explain again and again that he was not probably even tasting it, and that we should give him just plain juice room temperature. I see that even in the same family where you take care for the same kid who has this condition, you have different experiences, and you cannot have the same degree of learning. I realized also that my mother doesn't live in the same country as I live. At some point, I went back to Italy, my home country, with my son, and I said, can you take care of my son? And we go around in the city center for 1 or 2 hours. In the beginning, she said yes. And then she was panicking because she realized that as soon as I left the house, she had so many questions coming up and she was calling me every 5 minutes. So I think the first step of education is trying to have everybody on board in the family, more or less at the same level. And in the end, I realized that my son, that is now 10, is sometimes teaching the people around him about his own diabetes better than anybody else. Even if he's just 10, he knows everything about curves and going down and up and having done sport and walking. I just walk the dog, so even if I'm high, I can have something. I can have an apple, and I will not bolus anyway because walking the dog made me spend so many calories and stuff. So yeah, I think he didn't know much. I knew a lot. Then he came back and he knew more than me. So the most important thing in all that is sharing experiences.
Thank you. And yeah, Manuel, are you going to say something?
Well, yeah, I was thinking.
You don't have to. It just looked like you were going to say something, and then I want to cut you off.
It's a great question. So, well, I think it is not easy to accept diabetes for oneself. Like it's difficult to accept like you live with diabetes and what living with diabetes means. And I think that it is also very difficult for those around us. So, well, yeah, even though the support from those around us, like family, partners, and friends, is important. I think it is difficult for them. So, like the same I said a couple of questions ago, I think we should be more patient and to understand that maybe they also want to understand what we are living in the best possible way. In the end, they are our families and our loved and close ones. So yeah, I think they are always looking for the best for us. So I think it's very important to be very honest about how do you feel about your diabetes with your family and the people close to you, because this will help to make them understand that it is not that easy and like it is a full-time job apart from all your other activities. So they should have this in mind to know how they can help you.
Thank you, Manuel. And yes, I agree with both of you in the sense that that's something that's also often overlooked. And I'm going to join to the next question with this, is that often we forget the mental health impact that a diagnosis or life with diabetes not only has on the person living with diabetes, but those of them caring for them or loving a carer. You know, a parent of a parent also is hurting for their child when their child is diagnosed, you know, so grandparents are also. And then, like Francois was mentioning, they can also be afraid and they can also be worried because they don't want ever to their kid to be hurt in any way. But often mental health is left out of diabetes education. And I know the voices and are trying to make this change. But how would you say, would you say that mental health aspects of living with diabetes, and this is for all of you, would you say they are covered in diabetes education? Would you say when you were educated about life with diabetes, mental health was a part of it, or would you say still left out? What are your thoughts on this? And I would love to hear from all of you if you're willing to share.
Thank you.
Oh, go ahead, Heather.
It's okay, you can go ahead.
Well, when my son was diagnosed, he was just over 2. So actually, they didn't take that much into account his own mental states, which sounded to me a bit strange. They were only asking us as parents if we were okay, which we were not actually at all. And he only started seeing a psychologist when he was 4 or 5. And I realize now that he's 10 and he's a very stressed little boy. He's very intelligent. He's #1 in maths. He knows everything about graphs and percentages and nutrition, but still he's very stressed because he has this impression that he can control everything, because he knows he can control his diabetes. So he wants to control all the rest, same way. So I think we should probably have asked earlier for him to see somebody. And I think the mental stress that he's going through every day is very, very big. We've always talked about it with him since we realized all that, and since he started talking about it. And we're very lucky because he has a teacher at school that says, for example, if one day you have a test and you don't feel good, and I see that your blood sugar is not good, then we can do the test at another moment. You do it again. And I saw his stress level going down that year with that teacher. Unfortunately, he changed teacher last year. So education again, if we could make people have the same understanding of how it is psychologically to live with a lifelong condition that you need to monitor every 5 minutes, then they would probably be more understanding.
Thank you. Go ahead, Heather, that you wanted to also.
Okay, thank you. Okay, in my country, I think I can safely say that when it comes to mental health issues, in diabetes and even in general, it's only in recent times that people have started talking about mental health issues and coming out in the open. For a really long time, mental health is not something that people believe in. And it is something that it is actually considered taboo to be thinking about mental health issues. Most people, they have this picture when you talk about mental health, they see someone in rags eating from bins, and they don't really have an appreciation of things like depression and some issues that come with managing conditions like diabetes. So, but we are grateful that people have started coming out in the open, even in diabetes education. I think of late, I've seen people talking about drug abuse, people talking about the mental impact that diabetes can have. And we hope that we can continue with that conversation. We can continue promoting mental health knowledge and issues in diabetes education. And hopefully we'll get there. Yeah.
Thank you so much. And yeah, I couldn't agree more. I don't know, Manuel, if you wanted to share, but you don't have to if you don't, but I just wanted to not leave you out on this question, because I agree with the both of you. It's often so left out, the mental health, and it's difficult to be able to talk about this. And I can see in the chat that a lot of people are saying they have scare resources, they have never been talked about. And we often focus on the physical aspects of life with diabetes, and mental health aspects, social aspects, emotional aspects are often left out. And this is part of being a human, not only a human living with diabetes or loving someone living with diabetes. And when a condition such as diabetes comes along, our mental health and emotional health, social health can be impacted. And it's time to also acknowledge the fact that there's value in actually talking about mental health in the same way we talk about treatment, in the same way as we talk about hypoglycemia, hyperglycemia, and every other crucial aspects of life with diabetes that we live and understand. So I really appreciate that we got this question. And I would like to bring something up, because someone had mentioned that it's been difficult to accept their condition. And I wanted to ask if you had any comments on this. What would you want to share with this person, or has it ever been hard for you? And also, Francoise, has it been hard? You mentioned that you were not doing well when your child was diagnosed. So what comments would you have for this comment? And thank you very much for this person who shared this with you. Thank you for bringing it up, and thank you for sharing it in our comments.
It's a bit difficult for me to say that, but it was very difficult to learn that my son had this lifelong condition. Then when we started understanding more and more about it, it was easier to accept it, until the moment where he was 7 or 8 and he started to realize, and one day he asked me, Mom, why, and is it going to last forever? And that was really, really hard, because I had to tell him yes. And I wanted to tell him that he's so perfect on every other aspect. He's so intelligent, and also sometimes because of his diabetes, he is so intelligent because he learned lots of things. But I refrained from saying that because it's no use. His question is, I have a burden and I will always have that burden, even if I know that I learned many other things, that I'm very intelligent. Because of this burden, I still have the burden. So what we try to put in place is a different way of approaching the medications. We started just with finger pricks and in manual injections, and we continued that way for 3 or 4 years. Then we moved on to having a freestyle, so a continuous glucose monitor. And my son didn't want to have a pump, and 6 months ago I managed finally to convince him to have an Omnipod pump. So he realized that we didn't take his illness off, but he doesn't have to have a long lasting in the morning, a long lasting in the evening, less needles, less invasive. So actually improving a little bit the technology helped him think a bit less about his blood sugars levels. But indeed, it's a challenge for parents, and it's a challenge for the kids, and it's a challenge for adults, because even if we talk about type 2 diabetes, and we can say to somebody who is affected by type 2 diabetes, you can reverse it by doing sports and taking care of your intake, it's easier said than done. You need to acknowledge that it's really not easy, that you have to put on a layer of discipline to your life, a very strict discipline. So I think what is really important is to try to manage to find pleasure in all the other aspects of life. If you like painting, doing yoga, walking your dog, listening to music, climbing, because life is not only eating and drinking and taking care of your diabetes. So discipline is only needed to be able to enjoy all the rest. Yeah, it's hard. But again, I think what is important is to face that as a team.
I agree. Thank you. Yes, diabetes should not be done alone. Do Manuel or Heather want to join in this one?
Yeah, I want to join on this. Also, Francois, your testimony is very valuable and beautiful. Thank you. Well, I think that when I was younger, I felt very ashamed of living with diabetes. So it was like an obstacle to accept my condition. But then, like growing up and getting to know myself, I remember thinking like, okay, I live with diabetes and I'm going to live with diabetes maybe my whole life. So I need to make living with diabetes look cooler than it does, you know? So it was like this process to me to accept my condition and make me feel better about living with diabetes. Like, yeah, I will get to the highest level of whatever I want to do with my life or whatever I want to do yeah, with my life and my personal goals and professional goals. So that was like the secret formula I used to accept my condition.
Thank you. Thank you so much, Manuel. Do you want to say anything on this one, Heather, or should we continue to the next one?
Okay. Yeah, just to say, maybe one great lesson that I've learned about living with diabetes. There was a time when I was really, when I would really get frustrated at why people didn't understand me or my condition, and it would really put me down. But I would, at the end of the day, I've learned that my condition is my responsibility and people can understand only to a certain level. It's not possible for people to be able to put themselves into my shoes and be able to understand everything. So I've learned to take care of myself and not to expect other people to understand, but to create my own happiness and my own fulfillment. And not based on what others think or believe about my condition.
Thank you. So moving to a next question, because we have so many, and thank you for everyone who's participating and sharing their questions. I would love to see that, well, often, like you're saying, we have different realities, different situations, but often, like mentioned before, it can feel isolating, diabetes in itself. And like you just mentioned, Heather, it can also be frustrating not being or felt understood. So what do you think about, and this goes to all of you, how do group self-management education, is it an approach that can be beneficial in reaching more people with diabetes, both type 1 and type 2, specifically for those who may not have an easy access to care? Thinking about those people that might not be able to continuously go to clinic or to have access to healthcare professionals in a transitional way. How do you feel about this? And do you think that group self-management education can be powerful and helpful? You can all
okay, I can start with this one. Thank you, Danny. Well, it is a really interesting question. I think that if we connect people with diabetes to support themselves, it's like a good way to start with this more inclusive and more empathetic diabetes education. So yeah, like yeah, if we have this group self-management education, I think we can make a better approach of what we want people with diabetes know about their condition, like starting from accept their condition, and also to have to make the right decisions in the most right or better way, I think. So yeah, it's something that we do a lot here in Mexico. Like we work with the community, like people from the community help other people and support other people from the community, from the diabetes community. And yeah, that's a good way to start.
Thank you. Anyone else want to join on that one?
I was thinking about diabetes hotlines. I don't know if they do exist, but volunteers answering calls on diabetes hotlines would be a very good idea. Now, I don't know how we can be sure that people have enough knowledge, but I think for basic questions, Somebody talked about Q&As that were, I think Heather was collecting all those questions and answering, and that was already a very good idea, I think. And maybe create a YouTube channel with very short videos, very simple ones to address the biggest questions people in remote areas might have.
Thank you. And we just got a comment on great idea on a hotline. So thank you for that one, Rosa. And going on the other end, you know, that's also very important. And I believe that without a doubt, healthcare professionals, not only endos and physicians, but also dietitians, and mental health professionals and other providers are very valuable and extremely valuable in life with diabetes. So how would you say that healthcare professionals could support on supporting diabetes awareness? And I believe this is a very important question, as often advocates say that we really need, and we often use this phrase, which is bridge the gap, and hopefully have a better understanding between people living with diabetes, people loving and caring for people living with diabetes, and healthcare professionals. So how would you think healthcare professionals could support the community in creating more awareness and being more able to our community as a whole? And this is a question for all of us. So feel free to join.
Okay, I think that healthcare professionals should make this approach to their patients and people living with diabetes with an empathetic perspective. Like, we do not choose to live with diabetes, you know? So if you have like this empathetic approach to your patients, I think that they will understand better the message you want to give to them as a healthcare professional. Also, in diabetes management, you have to have this multidisciplinary approach of different type of healthcare professionals. So yeah, the only way to help the person live with diabetes is to understand what we are thinking and what we are experienced with our diabetes and all these obstacles and challenges that we have. So you can tailor your diet or your I don't know, your the scheme you use to manage your condition.
Thank you, Manuel. Anyone else want to join on this one?
I would say the different types of healthcare professionals that we have in the management of diabetes. If we look at people like endocrinologists, diabetologists, dietitians, and so on, I think they should be able to come together at the same table and to be able to establish partnerships where they can discuss and share insights, as well as develop comprehensive plans for their patients. So I think it's very important that they come together and have a collaborative approach. I'm sure if they do so, they'll be able to come up with more enriched plans for patients.
Thank you, Heather. I couldn't agree more with what you're saying. I would like to add on the fact that bridging the gap also requires for us to help healthcare professionals be a part of what life with diabetes actually means in real life. And I think that's important. One of the biggest things we managed to do here in Costa Rica was when we invited every doctor that collaborates. I am aware my country is a small country. This is why we were able to do this, and to bring them on a 2-day camp and to see them actually look at kids and teens, play sports, go to bed, having to continuously wake up to hypoglycemia after a wonderful day of joy. And it made them understand that it was much more so than just the dosage and just the meal plans for dietitians as well. We also had psychologists that made a tremendous effort, because it was more than just this a chronic condition. It was everything that it required to be thought before going into the pool or going into a play. Or we had various teens very much trying to fall in love with other teens in their cabins, and how much all this nervousness actually impacted their blood sugars and how they were feeling around it. So in order to bridge the gap, it's also, I believe, a tremendous value to have them experience what life really looks like for a person living with diabetes. And as a mental health care professional, I also believe that of this, for me, one of the most important things is to actually understand that we are much more than just the number, and that we could be 100% time in range, but if emotionally and mentally we're not there, this is absolutely at our most risk. And it's at risk in our own health. It's at risk in the way we relate to others, we relate to our school, to our jobs, to our siblings or our partners in life. And that this is why also talking about mental health and actually really making a multidisciplinary team understand that it's exactly that. It's, yes, the number, of course, that the number is really important, but the effort that's behind it, the family that's behind it, as you all three were mentioning before, is of tremendous value. And that only can help bridge the gaps. And I know that can be tricky, but there are also a lot of healthcare professionals out there that now want to join and help and create awareness. And one of those things is really allowing them to have any insight that parenting and mothering means for diabetes or living, and this could be done through various activities. So I think that that could be of a lot of aid. So thank you for who came up with that question. I think it's of tremendous value. And one of the things that is often not talked about as well is, and I think Manuel, you were commenting on this a little bit before, is how can diabetes education help people access healthy foods? And this is important because you mentioned before that it was something about expenses. And I think that people living with diabetes, and probably a lot of us here, can relate to the fact that living with diabetes can look expensive and feel expensive, including that products that are non-processed or diet seem to or tend to be at a higher price. So would you say this can impact, and I myself can say that it can have a mental burden thinking about this, but also proper diabetes education can teach us that we can have healthy lives, but accessing healthy meals that do not need to be overpriced all the time. So how would you feel about this?
Okay, I will start. Wow, what a great question. Yeah, I feel expensive all the time. And I start working and I feel now like more expensive. But well, I think that, yeah, we should understand our diabetes as something that we do not choose. So, well, it's not my fault, but I can make the best decisions to use this technology that I have access, or all the supplies, the limited supplies sometimes that I have, to manage my condition in the best possible way. So I think that's the main key of the right diabetes education. Like, the right diabetes education will help you to manage your condition in the best possible way, or with the best possible decision that you can make. If you find the right training and the right decisions, and you do not always need the top technology in diabetes to manage your condition.
Sorry about that. Does anyone else wants to join and take a Francois, or should we go to the next one? You go ahead.
I think that for many reasons, we need to teach our boys how to cook. First thing in, they will cook for us. Second thing in, they will cook for us things that we as ladies love, vegetables. And yeah, they will go less to the boxes of biscuits and stuff if they know how to prepare eggs with bacon, and they will have the pleasure to say, I did it myself. That's what I have with my son who's 10 and can cook me eggs and bacon on a Sunday morning. um, yeah, I think we need to get used to different tastes, and not only in the in this discussion about diabetes, but also in life in general, to take care of our health, and also to for our environment. It's much better to eat and consume and use and buy unprocessed foods.
Yes.
Yeah.
Go ahead. I just wanted to say thank you because I thought that was a great comment.
I don't want to be too critical about all that. I just wanted to say something, if I can step back one topic. Every time we go to the hospital, every 3 months to see the endocrinologist, he's always concerned with curves and the medium values and stuff. And sometimes we tell him, he says, my son doesn't have enough lows. And in order for his diabetes to be balanced, his HbA1c need to be lower. What I tell him sometimes is he also needs to enjoy life. So if we go to an amusement park, I'd rather have him at 120 all the time and enjoy himself and not think about having to correct his lines and his blood sugar high or down. Because for me, it's important that he accepts it on the long term and he doesn't feel as if diabetes is preventing him from enjoying life.
Thank you.
Yeah.
I think that's a great answer. And I think coming back to where we're starting, I also believe as well that actually teaching not only kids, because we now know more than 50% of people diagnosed with type 1 diabetes are adults. And we do know that now we also have a big community of children in type 2 diabetes. Type 2 diabetes is in all ages now. And one of the big important things is the way we work around mental health and how we relate to food, right? Instead of being it a terrible thing, something to be fearful of, it is important to actually allow and work on having healthy relationships with what we're eating. And it might look different for everyone according to their backgrounds, according to even where they're living. But this does not mean that we cannot work on hopefully aiding people in having healthy relationships with their food. And a lot of that comes from teaching them about food. And it's more than just carb counting. It's also about the value of it, how to prepare it, how to cook it for the present and the future. And that starts with sustaining healthy relationships with what we are eating. So thank you for that very powerful remark. I couldn't agree more. So going to another question, and coming along, you also mentioned way back at the beginning about cheese and how you had to teach people about cheese and how he could have it as a snack instead of a cookie. And this only shows that outside of the diabetes community, we still have a long way to go in regards to diabetes education. So for all of you as well, how can we use education to raise awareness in the general public and wider working communities? Because yes, people with diabetes, we also work and we also go into different communities from school to work. And how do you think we can use education to raise awareness outside of the community?
Okay, Danny, I believe that to raise awareness and visibility for our condition, and also to eliminate the stigma of living with diabetes. I think we are slowly being the stigma is slowly being eliminated with the testimony of people living with diabetes. When we have this kind of chats and panels and webinars, we are living examples to demonstrate that people with diabetes can live healthy and fulfilling lives and achieve their goals and their dreams. And yeah, I think that's the best way to raise awareness with the education. Like, yes, I am a person that lives with diabetes, but also I am, I don't know, like a really good athlete or a really good lawyer or professional or psychologist or whatever that you are doing. I am reaching like the highest level of performance, and I live with diabetes too, you know? So that I think that is like the best way to raise awareness. And well, yeah, achieving excellence in our personal and professional lives is like the best way to empower ourselves, but also to raise awareness on what living with diabetes truly means. So I don't know, I think it is very important to talk about your diabetes openly and honestly, and well, share your story with other people with diabetes and with and other people that does not live with diabetes. And also doing this, we are getting involved in the diabetes advocacy, the awareness, and the visibility of what living with diabetes really means.
Thank you.
Okay, I would also say that let's not restrict ourselves to the hospitals or to the places, the usual places where we find the advocates or diabetes educators. Let's go into the communities. Let's go into the schools, workplaces. Let's go into the churches. Anywhere where you can find people, you can be able to talk about diabetes, and that will bring more understanding and more appreciation, and that will lead to less stigma, less discrimination. If we take the example of HIV/AIDS, everyone knew about HIV when it was still the thing, and there was a lot of campaigns centering on it. It was there on the media, everywhere it was HIV. Let's do the same with diabetes. I'm sure we'll be able to achieve more if we do that.
Thank you. Wonderful. So we're almost there. Can you believe it? We only have 7 minutes. So I'm gonna go with this one, which I think it's a wonderful question, because it's often also difficult to find communities. There are a lot of countries who have very strong communities within their country, but some of them do not have. And now, thanks to what we're doing here today, we have people from Belgium, from Mexico, Costa Rica, and all the world, and Zimbabwe just joining through a Zoom chat, and there are various organizations that have made this possible. So as people living with diabetes, what are some of the patient support programs that speakers can you talk about doing a diabetes engagement and awareness programs? Which would you say had helped? And how do you feel about, for instance, you're all part of the well, Manuel, you are from the Young Leaders Program, and Heather and Francoise are from the Blue Circle Voices. How do you think this has aided you, and how do you think this has helped you in creating awareness and engagement and being educated in life with diabetes?
Okay, Danny. Well, I am a YLD from the IDF. By far the greatest experience in my life so far. But well, yeah, we have like the community have these forums and these places and these groups that allow you to be a speaker and raise awareness. Like this chat that we're having today, I think is a very valuable forum. Like people from the community, we always appreciate like these moments because I think we can learn a lot of new things from these chats, but also we can make ourselves feel understood and that we are not alone. And as a YLD, I can raise awareness, and also the program allows you to develop a program that can help your own community. Like I have met a lot of people from all over the world with different perspectives and different approaches to their local and regional problems and obstacles, and they can and this helps you to design and develop a program tailored for your own community or your own country to help your community. So well, yeah, the YLD program is really cool. I love it, and yeah, I'm really happy to be part of the YLDs.
Mhm. I would also want to commend the IDF for all the work that they are doing. There's what the IDF School of Diabetes, and I know recently they've been advertising a lot of courses for healthcare professionals, and they also have a lot for even people with diabetes. There's a course called Understanding Diabetes, and also a very good work through the different networks, the Young Leaders in Diabetes, as well as the Blue Circle Voices, supporting programs and projects in the different regions and countries. And I also wanted to talk about the kids program. It's another initiative of the IDF where they are going into schools. I really thought that was a very brilliant idea of trying to catch them young, and this will go a long way in making people understand more about diabetes and in diabetes management.
Thank you so much, Heather. And going to your comment, I would like to ask, maybe because we're short on time now, maybe Francois and Manuel, could you just so kindly mention it? Thank you. Heather, and your thoughts about the IDF School of Diabetes group. What would you think about that? For those who don't know, what are your thoughts on that, and how's that impacted? And Heather, please feel free to add anything on else, because it would be great for us to learn from your experience and what has that given you in regards to education.
Yeah, I think the idea of School of Diabetes is it's really helping in giving that foundational knowledge about what diabetes is, what are the risk factors, what are the causes, what are some of the complications. And they are also very consultative, making the whole process very inclusive, reaching out and asking for opinions on some of the aspects of the courses and some of the materials. So I really commend that, and I hope they are going to continue having more programs of that nature.
Thank you. Manuel, Francois, would you want to share on this one as well?
Okay, yeah, sure. I just think that all the information and data and resources that we have with the IDF and also with the IDF members, like the local and regional members, is very valuable, and you should give it a try.
Yeah. So we're a minute away. Francois, did you want to join anything else?
I wanted to say that the IDF actually gave me the courage to accept the invitations I had from the school of my son to present in a simple way what diabetes was. And in the beginning, I was only considered as the mother of Aristide. And then at some point, I realized that I had a foundation I could stand on, and I could say, yeah, I'm doing advocacy also, and not only for him but for all the other kids and people affected by this condition. And I felt very proud because I was listened to as a specialist, like some doctors that would be invited at his school. And I think it helped unstress a bit the situation. So thank you very much for existing.
Well, I don't think it could be a better note to put in ending to this, but I would really want to thank all of you for your time, for being here, for sharing with our group. Thank you for everyone joining, for your questions. And of course, thank you, Blue Circle Talk, for this opportunity to be here on this very important day on education and making it about diabetes education. Because as we all know, that diabetes education is not part of the treatment, as it said, Justin said it is actually the treatment, and without it, managing it can be really tough. So thank you for sharing. Thank you, everyone who invited us to be here today. And we just want to let you know that the recording and the slides and the feedback will be sent in a few days. We would really much appreciate for you to respond the questionnaire. This will only help us do this better. And if you have any questions about it, make sure to email at advocacy@idf.org. And we're just so happy to have started the day off, or close the day off wherever you're at in the world, with this wonderful conversation. Once again, thank you, Manuel. Thank you, Heather, and thank you, Francoise, and thank you, everyone behind this wonderful panel that make it possible. And thank you all for being here and sharing with us on this day. Thank you very much, and we hope to see you soon again.
Thank you.